Big thank you to the Huntington's Disease Association for inviting us here today to talk about pre-implantation genetic diagnosis. My name is Kathryn Lubasch. I'm a principal genetic counsellor at Guy's Hospital, and I work as part of the PGD team there and the general genetics team. And this is my colleague Devon. I'll let you introduce yourself, Devon.
Yes, hi, my name's Devon Haynes. I'm also a principal genetic counsellor at Guy's Hospital, and I work as part of the PGD team as well.
Let's talk about what PGD is. So it's a special form of IVF treatment. So people who have PGD go through an IVF process, but before they any of the embryos are transferred into the woman, then the embryos are tested for specific gene change that's associated with whatever the condition in that family is. So what we're doing is selecting the embryos that are unaffected by the condition. So it's not a way of editing the gene and fixing the gene. It's looking at whether that specific gene change is there or not. It is a very tightly regulated procedure. So the Human Fertilisation and Embryology Authority in the UK, the HFEA, oversee all of the PGD that we offer and the conditions that we're able to offer it for. And they have issued a license that allows us to do PGD for Huntington's disease. The nomenclature, the names of the procedures are sort of changing a little bit. So you might see PGD now referred to as PGTM. So if you see that, it's the same thing. The new wording around that is because they also have some other types of PGT. So you might see PGTA. That is sort of screening for chromosome conditions. It's PGTA is a little bit controversial around the evidence of how helpful it is. If you see PGTM, then that is referring to PGD. So how does PGD work? And I'm going to stick with using PGD through this talk. So I'll just talk through the sort of process that you might go through if you were having PGD. So the first thing that would happen is that you speak to your local genetic counsellor about the different options that are available to you, and then they would refer you to a PGD centre such as Guy's. And we would have a look at that referral to see if there's any more information we need. Sometimes we need the laboratory to review it before we can offer any appointments. And then you would have an appointment with one of the genetic counsellors working for the PGD team. And they will go through everything in that appointment in terms of sort of what you can expect, so that you can understand the process, and hopefully that then helps you to know whether it feels like the right option for you. And they'll also take some medical information, some family history information that we need if you then go on to have PGD. So after that, you will let us know what your decision is, and if you've decided to go ahead, then you'd be referred to our assisted conception unit, and they will do some fertility checks for you, and they'll go through the consent forms and things that are needed. They also undertake a welfare of the child assessment, which we'll talk a little bit more about in a moment. And then you will learn to give yourself the hormone treatment at home to stimulate the ovaries. So that's some injections that you have at home. Then there will be another appointment to collect the eggs and the sperm. And that procedure is collecting the eggs involves a sort of heavy sedation, so it's a bit like having a surgical procedure, that one. And so you sort of have to plan around that. And then hopefully at the end of that, then there's egg and sperm available, so we can create embryos and grow them, and then take some cells from those embryos, and they take cells from the part of the embryo that goes on to become the placenta and the other tissue, rather than the cells that are making the baby themselves. And then they can test those cells and see whether that gene change in the family is there or not. And then hopefully there's some embryos available that then can be transferred, that don't have the genetic condition in the family. And so you come back in for that embryo transfer. That's a much more straightforward procedure. It doesn't require any anesthetic or sedation. So some things to sort of think about if you're weighing up PGD. It is quite a complicated process. So there's quite a few appointments that you would have to attend. There is a lot of sort of waiting while things are being reviewed by different people, while the laboratory are making the tests that you need, because they have to make that test for each individual couple. And so I think my experience is that can be a really difficult time, sort of when you're just sort of waiting for things to happen, and it's a little bit out of your control, getting to the next step. Emotionally, it can be quite challenging. First of all, just the impact of injecting yourself with hormones can have an impact on how you're feeling. But also, it is a long process, and like I said, there's a lot of different stages, and it can feel sometimes like a lot of pressure for it to work. And we do have counsellors that are available as part of the process, if you just need a little bit of extra support along the way. It's really useful to sometimes think about what else is happening in your life around that time. So, thinking about if I want to have PGD, when is the best time for me to start that? Can I minimize any other, stressors or things that are going on, around the time when I'm expecting to start the treatment, or I'm expecting to have results, and just sort of, planning ahead so you can take care of your mental health and your well-being along the way. And sometimes thinking about who's going to support me, when it just feels, I'm feeling a bit fed up with it, or just worried about whether it's going to work or not. And so thinking carefully about, are there friends or family members that I can, let them know that this is something that we're doing, so that they can be there on the end of the phone, or available for a chat, if you need that. And we also often find it's helpful to talk to your work, to your manager maybe, about going through the process, so that they're sort of aware and have that flexibility around appointments and things. It is a long journey, so it varies for different couples. So it's difficult to give a sort of general time frame, but I think, on the whole, you need to have in your head that we're looking at between 1 or 2 years to go through this process. Once you're referred, you can get a little bit of a better idea around that timeline, but to have that in your head when you're planning things. And I mentioned earlier about the welfare of the child assessment. So this is something that we have to do legally. And so what will happen is that you're just asked to think about There's some questions around what support you have, any mental health problems, any criminal convictions that might be relevant, and then a discussion around, what will you do if one of you does develop symptoms, or if something unrelated to Huntington's happens to one of you, what support have you got in place to help you look after any child born through this process? So just thinking a little bit about that ahead of time is really useful. Okay, so are there different types of PGD for Huntington's disease? So what we would group these into sort of standard PGD and exclusion PGD. So let's think about the standard PGD first of all. So this is for couples where one of them has had a predictive or a symptomatic test for Huntington's disease and has been shown to have that Huntington's disease expansion. So we know that at some point they're going to develop Huntington's disease. So what happens, the different centres do PGD in different ways. The way that we do it in Guy's is that we work out which chromosome is the gene change is on, that gene expansion is on, and we test for that rather than testing for the actual expansion itself. So the chromosome is just a package of genes, and we're looking at which chromosome that's been inherited on. And the reason for that, the reason we do that, guys, is we find that it's the most accurate way of doing the testing, because you don't get very much DNA from an embryo, and so we found that helps to reduce the chance of a misdiagnosis of the test not being correct. So with exclusion PGD, so this is where we know maybe, so if we think about me as an example, hypothetically, let's say that one of my parents has Huntington's disease, but I've decided I don't want to have a test. I don't want to know if I'm going to develop the condition or not. So this is a way of having PGD without me having to have a test myself, and without the results revealing whether I'm going to develop Huntington's disease or not. So this isn't a process where the laboratory know my result and are just not telling me. This is a different method, which I'm going to show you on the next slide. So if we look in the middle here, so we've got pictures that all these coloured bars are chromosomes. So if we look in the middle, we've got partner at 50% risk. So let's say Jane has a father who is affected by Huntington's disease. So Jane's father up here, we know that one of these chromosomes, because our chromosomes come in pairs, so we know that one of the chromosomes that has the Huntington's disease gene on it has that expansion in. And then this is Jane's mum here, who there's no family history and there's no reason to think that she has an expansion in her Huntington's disease gene. Okay, so we know that Jane will have inherited one copy of her Huntington's disease gene, so one copy of her chromosome that has that gene on from her mum, which we think is fine, and then one from her dad. But we don't know which one she's inherited, so we don't know whether this one she's inherited has that expansion on, because she's decided not to have a test. Okay, and then we've got her partner over here with the green bars, who again, no reason to expect that there's a Huntington's disease expansion in one of his chromosomes. So then when we make the embryos will get a copy of her partner's gene, so they'll have a green one, doesn't matter which one, and they'll also get one of Jane's chromosomes here with the Huntington's disease gene on. So one of hers will have come from her mum and her mum and one of hers from her dad. So because her dad's copy, we just don't know whether that's the one with the expansion on, we're not going to use any embryos that have inherited her dad's copy of the gene. What we're going to do is we're going to use the ones that have inherited her mum's copy, because we don't think that there's an expansion there. And so only those would be classified as the low risk embryos, and so only those would be available to transfer. So this is a way of testing of having PGD without having a predictive test yourself. It will reduce the number of embryos that are available, because we are cutting out any embryos from the selection process that have a gene from this person's father. So if we knew, then we would be able to keep some with the unaffected copy. So it does reduce the number of embryos, but it is a way of doing that without having to know your status yourself. Okay, so I'm going to hand over to Devon now, who's going to talk to us a little bit about PGD funding on the NHS.
Yeah. Thanks, Kat. So I'm going to pick up by talking about NHS funding for the PGD process. And this funding would be, like Kat said, either for the standard PGD or the exclusion. So both options can be funded by the NHS if you meet criteria. So on this slide, I've listed out all the different criteria for qualifying for NHS funding. So the kind of top criteria is that there is a serious genetic condition in the family, and that there is at least a 10% risk of passing that on to a future child. So this is like what Kat mentioned before, what the HFEA kind of regulates is what is considered a serious genetic condition and what isn't. So we have to have a license for every genetic condition that we do PGD for, and the HFEA will either grant that license or not after reviewing the genetic condition that we are applying for. As Kat said before, there is already an HFEA license for Huntington's disease, so we don't have to reapply for that license. Any family with a history of Huntington's would qualify under that kind of caveat. And the genetic mutation in the family or the genetic change in the family must be confirmed by a licensed laboratory and be confirmed to be either pathogenic, meaning disease-causing, or likely disease-causing. The female partner as part of the couple must be under 40 years of age at the time of starting treatment and must have a BMI between 19 and 30. And the reason that we set these parameters for the female couple is related to the chance of success for treatment. So as we know, as females, our fertility tends to decrease with age. And so that's why the 40-year-old cutoff is there, because kind of just our history and our experience with the process is that there's more success at ages under 40. And also the hormones that we use to stimulate the ovaries are fat-soluble hormones. And so we know that we're more likely to have successful treatment if a woman's BMI is in the normal range, which is set between 19 and 30 for this process. And so female partners must have a weight in between them. Both partners must also be non-smokers. This includes e-cigarettes and vaping. The couple together cannot have any living unaffected children together. So exceptions to this would be if you have a new partner, but you have a child with your previous partner, you and your current partner would qualify for NHS funding so that you could have a child together. But when you're seeking PGD, you should be seeking PGD for a genetic condition in the family, not because of fertility issues. And also the couple together must have been in a stable relationship for at least 1 year, and you must be currently living together at the same address. And so those are the standard kind of criteria for NHS funding. So are there other kind of options for funding PGD? And the answer to that question is yes. So we have 2 private pathways for PGD. The first is called the self-funded pathway. So this is for couples who would be eligible for NHS treatment, aka they're a UK resident, but maybe they just don't meet some of the specific criteria for the PGD. So you can choose to self-fund the NHS pathway. The criteria for self-funded PGD is the exact same as the one I just showed you. The only difference is that the female partner can be up to 42 years of age before starting treatment, but you have to show, if you're above 40, that you do have sufficient fertility and natural hormone levels for a chance of success with the process. And again, the BMI criteria is a bit more flexible, so it's between 19 and 32. So as I said before, this self-funded pathway means that you're just privately paying for the NHS pathway. So it would be the same timeline for treatments and kind of all the steps along the way. Typically, the cost of the self-funded PGD pathway is approximately £12,000, but it can vary based on obviously the individualized treatment that each couple needs. So it can vary a bit around that cost, but typically it's around that price point. The second funding option is our privately funded pathway. So this is open to any couple, so you don't have to be a UK resident, you don't have to have an NHS number, you're strictly paying for this treatment privately. Again, the criteria is generally the same, but there is a bit more leeway as well with this next step. So the female partner must be under 45 years of age. Again, you have to show that you have natural fertility and hormone levels that would be sufficient to have a chance for, say, again, is a bit more lenient, so between 19 and 35. And the non-smoking criteria is recommended but not required. Patients who fund through the privately funded pathway follow their own kind of timelines and pathway themselves. They have a named consultant for all their appointments, and you have a bit more flexibility in terms of booking. You can be seen in the evenings and over weekends. And because of that, the process typically tends to be faster than the NHS pathway. But the price for the private PGD treatment is individually tailored and personalized based on kind of how you choose to proceed and all the treatments that are necessary. So we can't provide kind of estimates for the price for that kind of care, but at your initial appointment, they can walk you through what that price point would be. Just to kind of a few notes on the self-funded and private funded pathways. So after your initial appointment, so as Kat talked about before, you have an initial genetic counseling appointment, make sure that PGD is the right choice for you. And then you would pay for the initial, the ACU appointment, so the assisted conception unit appointment, where they do all the baseline fertility checks that you would pay for at that first appointment. But then if you wanted to proceed with self-funded or privately funded treatment, after they give you the quote, if you're privately or self-funded, you would have to pay that cost ahead of time. So upfront before you begin your treatment. And then if for any reason the cost of your treatment varies based on that initial kind of estimate, whether it's more or less, they would either refund you the difference if it ended up being less than they estimated, or they would bill you for the extra additional cost if it happens to incur in the process. But the kind of full upfront price is due before you start that pathway. So how to access PGD is the same regardless of whether you are going through the NHS pathway or privately funded. But as part of Guy's Hospital PGD service, we do require that patients be referred by their local genetic service. So if you're followed by a local genetic service, you can just ask them directly for a referral to a PGD center. Or if you're not currently followed by a genetic service, you would need to ask your GP to go speak to genetics first. And really the importance of that is just to make sure that you have discussed kind of all the reproductive options available to you, to make sure that that is the right decision for you, and just so that you know all your different options in terms of family planning. And then that local genetic service can refer you into the PGD service, either at Guy's or at any other centers. And then that's when you would have the initial genetic counseling appointment. So thinking about what other things are needed for the PGD pathway, as Kat showed before, whether it's for standard PGD or exclusion PGD, we typically need samples from at least 2 generations in the family. So typically that is the couple themselves that are going through PGD, and then the parents of the partner that either is affected or is predicted to be affected with Huntington's disease, or is at risk of Huntington's disease. And that's, like Kat explained, to help set up the testing that is used to genetically test the embryos after they're made. And then, of course, we would need the genetic testing reports for the people in the family who have had genetic testing. And like we spoke about before, these labs must be accredited. So any NHS lab will be accredited, but it can't be from a research lab or on a research basis. But we would ask for all of this information with the referral that would come from the local genetic service. So typically when patients are referred in, we require all this information ahead of time. So just to say that if someone in the family hasn't had confirmatory testing but would like to think about this process, these are all steps that would have to happen before a referral was received by our PGD service. So where can you go for more information about PGD? You can, again, ask your local genetic service to kind of go through all this information with you, but you can also visit our website, which is listed here on the slide. That kind of goes through our specific PGD service and what we offer. There's also information about PGD in general on the HFEA website, which is the governing body we've been speaking about. And so we can include the link for that as well, in case anyone has any questions about PGD in general that aren't specific to our particular service. So if you do go on our website, the Guy's and St. Thomas's PGD service website, we do have patient testimonials. So stories of couples who have been through the process that would like to share their experiences about how it was. And so sometimes that can be helpful, like Kat said, to understand how kind of long and complex and emotionally tolling it is. So they are very honest about kind of how difficult that process is to go through, but also how rewarding it can be if it's successful. So if you're considering going through PGD, I would say that those testimonials are really helpful to kind of understand what it's like to actually go through the process. We've included one testimonial here that have shared on our website. So this is Christina and Joel, and I'll just read through that just so that in case you guys can't read it on your screen. But it says, in 2017, I married my husband Joel, and we decided that we wanted to start a family. I was born with facioscapulohumeral muscular dystrophy, and there was a 50% chance that we would pass on this condition to any children conceived naturally. Given that it is difficult to predict the severity of the condition that we may pass on, we chose to start our family through PGD. It has been an amazing journey, but definitely not an easy route. PGD is not a quick process. It took us 15 months from the initial referral to the first embryo implantation. For me, this was the biggest challenge, trying to be patient and manage my desire to become a mom. Keeping busy definitely helped, and picturing at a time, I would hold my baby in my arms. The injections to increase egg production can be daunting. My husband stepped in though and managed these for me, which helped enormously. It was teamwork. The egg collection process went well and we had 26 eggs collected. However, only 6 embryos survived the initial growth period, and out of that, 3 could be transferred. I remember when we were told this that I felt some worry at such a reduction, but I tried to remain positive. Our first embryo transfer was unsuccessful, which I did find very hard, but the team at Guy's and St. Thomas's were very supportive, answering all of our questions. Then our second embryo transfer was successful, which was an incredible feeling. We welcomed our daughter Ella into the world on the 7th of May, 2020. I can't thank the team at Guy's and St. Thomas's enough for their guidance throughout this process and ultimately giving us the greatest gift of them all, a beautiful baby. For other couples considering PGD, I would say patience and communicating with your partner are key when things are difficult, keeping picturing the end goal. So that's just one of the kind of many testimonials that are there. But like I said, they kind of give a firsthand experience on what that whole process is like.